Well, the 2018 legislative session was a short session this year, so we went from January to mid-March. It was relatively uneventful as far as controversial issues, although at the end of session, they did fail to pass 5 bills that were considered priority bills in the calendar. So we will be coming back in mid-May for a short special session of just 1 or 2 days. So one of IHA's top legislative priorities was addressing the prior authorization process. And specifically, we modeled that on Ohio's legislation that they passed 2 years ago. And what we wanted to do was create more transparency in the process, speed up timelines in which we hear from health plans with an answer, as well as know if they do deny the prior authorization request, what is the specific reason for the denial. We also tried to address some of the issues on the back end when it comes to getting paid for those claims. In particular, we were experiencing flat denials for the entire bill when there was an unanticipated medical service or procedure. And so under the bills, it's phased in. The health plan would no longer be able to deny the entire claim, only ask for a retrospective review of the unanticipated service or procedure. So credentialing in the commercial market was also addressed, and that was through creating a provisional credentialing status. And what that would do is that once a healthcare provider has submitted their credentialing application to the health plan, if they have not heard from the health plan within 30 days, they are at least granted a provisional credentialing status. They can begin seeing patients and billing. One of the key priorities going into the session was addressing the overly burdensome regulation on Indiana hospitals by the surveying process. And so we were successful in passing House Bill 1260 this year. So we felt like this was not only a reducing regulation, but still maintaining quality patient safety. So the big priority will be the Alliance for Healthier Indiana topics, increasing the cigarette tobacco tax, as well as raising the age from 18 to 21 for tobacco-related purchases. And we really want to examine this under the lens of a fiscal committee this summer. We've already successfully had passage through a health committee during the regular session. And we really want to look at, how will this impact tax revenue? What does this mean for workforce and economic development? And so we hope to address those issues head on and gear up for the 2019 legislative session. So overall, the 2018 legislative session was really an incredible session for Indiana hospitals, and it can't be done without the full membership of IHA. And so we just wanted to thank you for all your help, and we couldn't have done it without you.